Over the last couple of decades, a big trend has taken hold in dentistry, the so-called universal treatment room. One room supposedly designed to handle any procedure at any time. Sounds pretty good, right? Simple, flexible, less complicated, and honestly, there's a lot of logic to it. It's easy to see why doctors like the idea, but here's the real question. Does a universal setup always make the most sense? What are the specific advantages, and are there any disadvantages? In this video, we'll look at the advantages, disadvantages of universal rooms and compare them with purpose-built approaches like dedicated hygiene operatories, surgical suites, and hybrid treatment rooms. Stick with me, and by the end, you'll know exactly how to design treatment rooms that maximize efficiency, boost production, and make your patients more comfortable without wasting valuable space or money. In order to focus a bit on this subject, I'd like to use a painful analogy. Think of it this way. What's the universal car? It's a minivan. It does everything, but if you're looking for performance, efficiency, or even pride of ownership, you might want something more specialized. A hotted up minivan is still a minivan. Universal dental treatment rooms are in some ways the same. They offer flexibility, but depending on your goals, they may not always be the best fit. Or, if you do choose to create them, you've got to do it very carefully. If you don't, you'll chew up a mountain of excess space, take on costs that won't provide a penny of additional income. Universal rooms have some clear advantages though. First, they're easier to schedule to. In theory, any patient can go in any room. Second, they're easier to stock. Everything's the same. And last, they make it easier to do same-day dentistry because of these things. Those are real benefits. But let's look at the flip side for a moment. The disadvantages of universal rooms are that universal rooms used for hygiene usually aren't stocked universally, even though they should be. And same-day dentistry? Honestly, it's often just a crutch for bad scheduling. And when you need to do same-day dentistry in any room, rapid carts are a much quicker room conversion solution. Why not fix the primary problem? Fix your scheduling. In fact, when we ask highly functional practices how often hygiene rooms, even universal ones, actually get converted into restorative room, the answer is almost always less than 10% of the time. So the promise of any room, anytime doesn't actually play out in reality. If you're building an office with plenty of space and budget, universal rooms may be the easiest solution. They simplify scheduling, make stocking straightforward, and they create a uniform experience across the practice. Universal rooms can be a smart move for practices that want operational consistency and don't need to squeeze in extra chairs. On the other hand, if your practice is space constrained, increasing room count often matters much more than universality. You might not want to construct doctor treatment rooms exclusively and instead create some hygiene optimized rooms. For example, would you rather have 5 universal rooms or 7 rooms with 2 or 3 of those dedicated to hygiene? If space is tight, most doctors would choose the higher room count. And because hygiene accounts for around 60% of foot traffic in a typical GP office, dedicating space to where the majority of patient volume is can make a lot of sense. Here's the key. Hygiene is almost always two-hand function, even with assisted hygiene, because that's generally tag team hygiene, not actually 4-hand treatment. If you stick a single hygienist inside a 10-foot wide universal room, you're wasting space. A narrower, purpose-built hygiene room is far more efficient for that purpose. Of course, you still need the right instruments within reach, your handpieces, scalers, curing lights, and utilities. But when designed right, these smaller rooms actually give you more capacity in the same building footprint and increase hygiene performance at the same time. And yes, with the right design, hygiene rooms can still handle operative or surgical cases when needed. And when you think about it, it's not like dentistry hasn't already embraced the concept of specialization. So let's talk about the other specialized room uses. First, oral surgery rooms are built differently for anesthesia and additional space needs. Second, orthodontic bays are laid out differently, even though we've got a better way to design those today. reach out to us, we can show you. And lastly, consultation rooms can actually be hybrids that combine treatment and consultation if done right. Universal rooms, dedicated hygiene rooms, and other specialized layouts all have their place. If space is limited, prioritizing room count with some dedicated hygiene rooms can transform an undersized space from a never successful practice to triumphant. Universal rooms may be the better fit if you've got plenty of space and want the easiest management. But it's far too easy to waste space, money, and performance if you don't get that right. The key is aligning your operatory design with your practice's goals, constraints, and growth plans. At Design Ergonomics, we've worked with thousands of practices to help them strike the right balance, whether that means universal rooms, dedicated spaces, or a combination of both. So if you're planning a new office, expanding, or just trying to make your current space work harder, reach out to us. We'll help you design a setup that maximizes flow, efficiency, and patient comfort. And don't forget to subscribe and turn on notifications so you never miss future insights. And thank you.